Hello everyone, I am Dr. Faheema Hasan, consultant hematologist at SGPGI Lucknow. So today we will be talking about what exactly is bone marrow transplantation. There's a lot of myths and misconceptions involved around this. So bone marrow transplantation or BMT is done in a lot of hematological and even non-hematological disease. So what exactly it is what we are going to see hereafter. There are two types of bone marrow transplant. Nowadays, we don't even use the term bone marrow transplant. Rather, it is called HSCT or hematopoietic stem cell transplant because what we are actually transplanting is the stem cells. So, there are two types of transplants. One is autologous BMT or HSCT or allogenic BMT or HSCT. So, in autologous bone marrow transplant, the patient's own stem cells are collected and they are reinfused into the patients. In allogenic bone marrow transplant, a healthy donor stem cells are collected and then they are given to the patient with disease. So when and where are autologous and allogenic transplants done? In majority of lymphomas and myelomas, we do autologous transplants. In rest of the hematological diseases, it's usually allogenic bone marrow transplants. So what are these stem cells? Stem cells are the cells from which all your blood cells are formed. So we know there are three kinds of blood cells, the red blood cells, the white blood cells and the platelets. So they all arise from a common stem cells which is called the stem cells and which is what is reinfused both in autologous and allogenic bone marrow transplantation. So I am going to compare bone marrow transplant to agriculture. When we are giving chemotherapy for lymphoma or myeloma, we are just abolishing some of the cancer cells. In autologous stem cell transplant, what we are going to do is like we are going to give high dose chemotherapy. Like how we do in agriculture, we remove all the weeds and we get the land ready for further processing or further growth of the plants. So we are going to remove all forms of cancer cells from all over your body, both in autologous, in allogenic. So after that, we are going to give the stem cells which goes from the circulation inside your bone marrow and start producing red blood cells, white blood cells and platelets. So this is the concept of bone marrow transplantation. So in allogenic transplantation, we usually take the stem cells from your siblings or brothers or sisters who have a match with you, and there are newer options like where even people who are not having a match, we can search through worldwide registries where we call them matched unrelated donors. We can collect their samples or blood as well and infuse into the patient. So how do we do the matching is by the so-called HLA matching, which we will discuss in another series. So first, what are we going to do? In lymphoma patients or myeloma patients, we try to bring the disease in control so that there is no more disease left in you. And then we give injections to the patients to increase the stem cell count in the periphery. That is, we give them GCSF injections for 4 to 5 days. And with the help of the injections, the stem cells come from the bone marrow to the periphery. In good old days, they used to collect these stem cells from the bone marrow itself. Like they used to put big needles inside the bone marrow and aspirate it. And especially in allogenic transplants, that was a big problem because a healthy patient is usually not willing to undergo a lot of injections and a lot of invasive procedures to collect these stem cells. But today, 99% of bone marrow transplantations are done just by peripheral stem cell collection. So there need not be any worry. In bone marrow transplantations, there is no surgery involved, there is not a lot of pain involved, and the only pain you are going to endure is the pain you will usually suffer when you are donating blood or anything. So no surgery involved, we don't use your bone marrows. So in patients in autologous stem cell transplant, what we usually do is we bring the disease into control and then we give these GCSF injections, make the stem cells come from the bone marrow to the peripheral blood vessels, and we do something called stem cell collection and we collect the stem cells and keep. And then we get the bone marrow ready, like how we do when we are doing plowing in agriculture. We get the land ready before we put the seeds for growth. Just like that, we get the bone marrow ready. So what we are going to do is we are going to give intensive chemotherapy, which will kind of remove all the cancer cells from everywhere and make place for these stem cells which we have collected to grow and make new cells. So that is what we are doing. We are ploughing and keeping the bone marrow ready, and we already have our stem cell collected. So after the land is ready, like that in agriculture, these stem cells are reinfused to the bone marrow of the patient, which is absolutely clear of all the cancer cells. And these stem cells go and sit inside the bone marrow, take 4 to 5 days or sometimes up to 10 days time, and then they start making your RBCs, WBCs and platelets. So this is as simple as that. This is autologous stem cell transplant. In allogenic stem cell transplant, say for example the patient has blood cancer or acute leukemia, we give chemotherapy, we bring the leukemia into remission, and then in the same way like we did in autologous stem cell transplant, we give more intensive chemotherapy. Simultaneously, we have a HLA matched sibling or an unrelated donor. We give GCSF for them and collect their stem cells and keep. So once the land is ready, like that in agriculture, their bone marrow is ready, these stem cells from the matched sibling or unrelated donor is infused into the patients. So they sit inside the patient's bone marrow and start making the WBCs, RBCs and the platelets. So these are the concepts, if you see what is involved in a bone marrow transplantation. Of course, it is not as simple as that. There are a lot of complications involved, but we are in a good era where our mortality rates are less than 5% in autologous stem cell transplant and less than 10 to 15% in allogenic stem cell transplant. In India, we are doing almost 2,500 to 3,000 transplants per year. In the worldwide, it is up to 50 to 75,000 bone marrow transplants per year with very low mortality. So what are the challenges we are facing? What are the things that patients must be aware? There are two things that are very threatening when it comes to transplants. So the most worrying thing is that there is a time period when you have no WBCs inside you. So the patients are a lot prone to infections. And the second thing is that we are giving very intensive chemotherapy. Because of that, there's a lot of tissue damage, mucositis. So there are a lot of complications also, but we are also in an era with a lot of antimicrobials available and a lot of supportive system and good nursing staff available. So we can call that what we are trying to do in a bone marrow transplant or hematopoietic stem cell transplant is that we are doing agriculture in a HEPA filtered room. So in SGPGI, we have HEPA filtered negative pressure rooms where even every particle is filtered and coming. So the risk of infections are very, very minimal. So this is what BMT means, and we have very good success rates and less than 5% mortality. As a matter of fact, our mortality in autologous stem cell transplant is less than 1% with less than 20% mortality in allogenic stem cell transplant. And it is indeed a complicated procedure, but we are in an era where we can tackle all the complications, and it is one way where we can give the hope of cure to patients with acute leukemia and lymphomas. So that's it. If you have any further doubts on what bone marrow transplant or hematopoietic stem cell transplant is, you are free to text me or DM me on my Twitter handle, Dr. Faheema Hasan. Thank you.